Hello everyone, I am Anshres from Team Aegis and this is our project medbase. The following are the sustainable development goals we have focused on, which includes good health and well-being, quality education, industry innovation infrastructure, as well as reduce inequalities. This over here is our team. We have our mentor Emanita ma'am who has helped us a lot in our project. We have Satvik who has worked on the UI and UX. We have Vardan who has worked for the front end and Venkat who has worked at the back end developing an architecture. Before we go on into the problem statement as well as the introduction, I'm sure each and every one of among us has at least once Googled some symptoms. For example, it could be something like a cough, a cold, or a headache, a stomachache, a random pain in our body, etc. And Google has given us interesting research. For example, sometimes most it was probably something harmless, sometimes it was accurate, and sometimes completely unexpected, like cancer. Which brings us to the question, how can a simple headache lead to cancer? Medical or medical industry is something that is extremely important, and medical health is one of the most important aspects of our life. Yet, there is no suitable database or a website where we can actually search and learn more about the diseases, about the medical terminology, or about what are type of diseases exist, what are its causes, what are its preventions, what are the treatment procedures available, as well as what has the government done so that it could benefit us the regular public. For example, what are the government schemes available, what all has the government research in the medical field so far, what benefits does the government provide for us, and etc. And nowadays we live in the 21st century. We live in the era of internet of things. Yet this is an issue that is still staying so far, and this actually leads to an extremely complicated issue of misinformation. This was clearly seen during COVID 19, where people were believing random Google searches and WhatsApp messages, which led to some consequences of people thinking they had COVID 19, but even though that was not at all the case at all. And that is exactly what we are trying to close. We are trying to close that gap where people have no knowledge and let them have some clarity about what exactly is happening, or oh, this symptoms lead to this. This is a general overall understanding of what they are suffering from. Medbase is a health platform that takes information from trusted medical sources itself. We make sure that it includes the disease, its name, its cause, and its prevention. And it is only and only for as an education matter. We are not trying to diagnose anything, nor are we trying to suggest anything. We are just providing the data as it is and telling you what all can be done, what all is there according to the specific sources from specific channels, for example WHO or government of UK, government of India, or Medline Plus, and etc. This over here is our prototype which we have worked on so far. For example, this is our home page. Over here, as you can see, this is the UI and UX design we have worked on so far and our front end developing. We have a quick health topics like, for example, what is diabetes, what is an heart health, or what is, let's say we go to tuberculosis. Here you have what is tuberculosis, what are its causes and risks so far, what are its preventions, what are its treatment, and what are the sources available for this. And we'll be adding more and more data as we go further into the backend. As this is a beginning stage prototype, this is the only backend we could do so far. As we go forward, we'll even provide why it's caused with an entire detailed paragraph that is easily understandable for general public. We'll also go detailed depth into causes and risk and what all latest treatment methods are available as well. And this over in case people have any issues with unable to speak also, over here we have voice command where if I just press this and say COVID-19, you get COVID-19. It's an infectious disease, and again the same causes and risk, prevention, treatment, and sources. And this is our disease search where you have n number of diseases. For example, what are all the metabolic diseases available, what are the cardiovascular diseases available, what are some infectious diseases available like dengue fever, malaria, COVID-19, cholera, typhoid, etc, etc. We are planning to add even more diseases and work even more to make it much more comprehensive and structured as well. And these are the schemes I've told you so far. For example, let this say I'm here, and it has taken my location to be in Telangana as I live in Telangana, and these are the national health schemes available. This is so that it can actually know your location and verify the regional schemes available. For example, we have here schemes in Telangana Arogya City Healthcare Trust. Let's just say you're from a different state, for example, Andhra Pradesh. You go to Andhra Pradesh, you select that, you press it at my location, you go down here, and you find one more Dr. Y.S. Raghosamy Healthcare Trust. So this is for regional based as well as national based water healthcare schemes are available. We'll also be adding what all has the research or breakthroughs that has been recently done in these industries so far so people can understand about it. And we are purely something that provides verified education, explain disease in simple terms, and sharing awareness. We do not provide any diagnosis because diagnosis differs from person to person. Every person's body structure is different, DNA is different, their immune system is different, their health and lifestyles is different. So we are not trying to diagnose anything. We are trying to offer them the latest resource available. We are trying to provide them something they can trust because we are not providing anything of our own. We are only providing from relevant resources itself. These over here are a few of the advantages of it. For example, we can, as the saying goes, better be safe than sorry. We promote early awareness and preventive action because you can take a step and actually know what is exactly going on. A simple cough which happens, you can, let's just say you have some disease, you do not know what exactly happening, you can just go search it, and if it's showing some similar symptoms to an serious disease, you can get it checked. If it's there, good, you found it early. If it's not there, also good, because it means you're not infected with it. Reduces anxiety and misinformation, provides clear structured information, connects to regional specific government healthcare, and encourages responsible health decisions. Disadvantage: we do not replace any doctors or hospitals. This is only for information, and so you can trust our website. Coverage is limited to high impact for now. We'll be adding more on the back end as well. And this requires regular expert view and updates. For this, we have decided to integrate an API so it can retrieve the latest information from official websites itself. And it depends upon the user's access as well as digital literacy. For this, we are planning to make sure you can the website can read out whatever diseases is. Like I showed you in the voice search option, you can say COVID-19, you can select it, and it will read out the entirety of it. Like for example, what are its issues, what are the causes, and etc. And medbase is not designed to replace anyone. It is built to guide people, because it is built to let people know what exactly is happening, because health is the most important aspect of our life, and we need to have an idea of what's happening to us. And these are the references which are used even in our website. For example, here you can go and you can go to research search. We'll just go to cholera, you can go to sources. We are only using sources from WHO or Maryland Plus, or we can go here. Let's say we go to tuberculosis again, we go to sources over here again, WHO, Maryland Plus, or RNTCP India. We are only using official sources. Like for example, over here we have used Maryland Plus, US National Library of Medicine, Indian Council of Medicine Research, National Health Service, and Ministry of Health and Family Welfare, etc. Thank you.